Animal inoculation, small animal, with observation and dissection. This test is used to observe signs of illness in inoculated mice for as long as 3 weeks and for the dissection of mice and preparation of tissue for microscopy to confirm diagnosis when mice become ill or die. Concentration, any type, for infectious agents. Concentration may also be referred to as thick smear preparation. The source samples are treated to concentrate the presence of suspect organisms, usually through sedimentation or flotation. There are 2 common methods of concentration for ova and parasite exams: formalin concentration and zinc sulfate flotation. The most common concentration methods for AFB stains or cultures are the N-acetyl-L-cysteine method, cytocentrifugation, and the Zephyran trisodium phosphate method. Dark field examination, any source, e.g., penile, vaginal, oral, skin, includes specimen collection. Without collection, specimens for dark field exam are typically examined within 30 minutes of collection. The term dark field refers to the staining method. If the lab is responsible for specimen collection, report 87164. Macroscopic examination, arthropod. This test is performed to identify arthropods that might be vectors of disease-causing organisms in man. Arthropods are small animals having a hard, jointed exoskeleton and paired legs. This group of animals includes lice and ticks. Method is visual examination, macroscopic, of the source specimen. Macroscopic examination, parasite. This test is performed to identify parasites other than arthropods that might be vectors of disease-causing organisms in man. Method is visual examination, macroscopic, of the source specimen. Pinworm exam, e.g., cellophane tape prep. This test may be requested as pinworm examination. Clear tape is applied to the perianal area. The tape is removed and submitted to the laboratory on a clean slide. Method is microscopic examination. Homogenization, tissue, for culture. This test may be called grinding or homogenization of tissue. The methodology is mechanical disruption of the tissue to enhance extraction of endotoxin. It may involve the use of sterile equipment, such as scissors, mortar, and pestle, or disposable grinders. Ova and parasites, direct smears, concentration and identification. Common names for this procedure are ova and parasite exam, or O&P. Stool is collected. The methodology of an ova and parasite exam for stool includes a direct smear and smear of concentrated material, such as formalin concentration technique or zinc flotation method. Identification is by observing parasites with the aid of a microscope. Susceptibility studies, antimicrobial agent, agar dilution method, per agent, e.g., antibiotic gradient strip. A susceptibility study is performed to determine the susceptibility of a bacterium to an antibiotic. The methodology is agar diffusion. The specific antibiotics could be chosen and limited. The test is reported per antibiotic tested. The agar dilution is reported as minimum inhibitory concentration, MIC, which is a method of measuring the exact amount of antibiotic needed to inhibit an organism. Susceptibility studies, antimicrobial agent, disc method, per plate, 12 or fewer agents. Commonly called a Kirby Bauer or Bauer Kirby sensitivity test, this test is used to determine the susceptibility of a bacterium to an antibiotic. Methodology is disc diffusion and results are reported as sensitive, intermediate, or resistant. As many as 12 antibiotic discs may be used per plate and the procedure is reported per plate, not per antibiotic disc. Susceptibility studies, antimicrobial agent, enzyme detection, e.g., beta-lactamase, per enzyme. Bacteria produce enzymes that can inactivate some types of antibiotics. This susceptibility test identifies those bacteria that will be resistant to certain types of antibiotics by detecting the presence of these enzymes. Susceptibility studies, antimicrobial agent, microdilution or agar dilution, minimum inhibitory concentration mic or breakpoint, each multi-antimicrobial, per plate. This procedure may be called an mic, or a sensitivity test. It is a sensitivity test to determine the susceptibility of a bacterium to an antibiotic. The procedure is charged by plate, not by antibiotic. Susceptibility studies, antimicrobial agent, microdilution or agar dilution, minimum lethal concentration, MLC, each plate. This test may be called an MBC, minimum bactericidal concentration. MBC is the dilution of antibiotic needed to kill the bacteria. Mics are tube dilutions read visually. Tubes that may visually appear to have no growth are cultured to solid media to detect a concentration of antibiotic where no organisms grow, MBC. Susceptibility studies, antimicrobial agent, macrobroth dilution method, each agent. This test may be referred to as an mic, minimum inhibitory concentration. It is a susceptibility test to determine the sensitivity of a bacterium to an antibiotic. The methodology is macrobroth dilution. Results are given as a minimum inhibitory concentration, mic, with an interpretation of sensitive, intermediate, or resistant. The procedure is charged per antibiotic tested. Susceptibility studies, antimicrobial agent, Mycobacteria, proportion method, each agent. Mycobacterium susceptibility test is a procedure done only on Mycobacterium, e.g., M. tuberculosis, M. marinum, etc. Proportion method is used and involves testing of a panel of antibiotics used only for the treatment of Mycobacterium. Results are given as sensitive or resistant. Serum bactericidal titer, Schlichter test. This procedure is called a serum cidal level, a serum bactericidal titer, or a Schlichter test. This test cannot be performed without a bacterial organism that has been previously isolated from the same patient. The killing power of the patient's serum against the isolated pathogen is measured. Blood is usually drawn and tested at peak and trough level of the antibiotic. Smear, primary source with interpretation, gram or Giemsa stain for bacteria, fungi, or cell types. Any smear done on a primary source, e.g., sputum, CSF, etc., to identify bacteria, fungi, and cell types. An interpretation of findings is provided. Bacteria, fungi, WBCs, and epithelial cells may be estimated in quantity with an interpretation as to the possibility of contamination by normal flora. A gram stain may be the most commonly performed smear of this type. Smear, primary source with interpretation, fluorescent and/or acid-fast stain for bacteria, fungi, parasites, viruses, or cell types. A fluorescent or acid-fast stain for bacteria, fungi, parasites, viruses, or cell types. These are stains usually for specific groups of organisms, e.g., Mycobacterium and Nocardia. Identification of Cryptosporidium and related parasites are examples of parasites that can be identified by fluorescent or acid-fast stain. An interpretation is included. Smear, primary source with interpretation, special stain for inclusion bodies or parasites, e.g., malaria, coccidia, microsporidia, trypanosomes, herpes viruses. This is a stain to look for inclusion bodies or parasites, e.g., malaria inside red cells. Its use to detect herpes has been outdated by amplification and immunological methods. An interpretation is included. Smear, primary source with interpretation, complex special stain, e.g., trichrome, iron hemotoxylin, for ova and parasites. This is a stain to look for the inclusion of trichome or iron hemotoxylin indicating the presence of parasites or their eggs. An interpretation is included. Smear, primary source with interpretation, wet mount for infectious agents, e.g., saline, India ink, KOH preps. This test may be requested as a KOH prep. A wet mount is prepared from a primary source to detect bacteria, fungi, or ova and parasites. Motility of organisms is visible on wet mounts, and the addition of a simple stain, such as iodine, India ink, or simple dyes, may aid detection of bacteria, fungi, and parasites. An interpretation of findings is included. Tissue examination by KOH slide of samples from skin, hair, or nails for fungi or ectoparasite ova or mites, e.g., scabies. Potassium hydroxide, KOH, PrEP and chalcofluor stains are the most common methods of looking for hyphal elements and/or yeast in tissue. The KOH causes a clearing of the specimen to make fungus more visible. The preparation is enhanced for microscopic observation by adding a drop of chalcofluor, a type of fluorescent dye, to the slide and reading the preparation with a fluorescent microscope. Toxin or antitoxin assay, tissue culture, e.g., Clostridium difficile toxin. This procedure is a toxin assay for diagnosis of toxin-producing organisms, such as enterotoxigenic E. coli, and Vibrio cholerae. Stool is collected for testing. Filtrates of the stool are inoculated into cell cultures and observed for CPE, cytopathic effect, microscopically. Confirmation of toxin production may be done by toxin neutralization. Different cell cultures are used to test for different toxins, so organism must be specified. Virus isolation, inoculation of embryonate eggs, or small animal, includes observation and dissection. This code includes observation for signs of illness in inoculated mice for as long as 3 weeks and dissection of mice and preparation of tissue for microscopy to confirm diagnosis when mice become ill or die. Virus isolation, tissue culture inoculation, observation, and presumptive identification by cytopathic effect. Cell culture is a procedure used particularly for viral detection. There is a general viral culture which can detect most viruses, but when a specific agent is suspected such as CMV, HSV, influenza AORB, mumps, or varicella zoster, more specific and rapid culture techniques can be used. This procedure provides presumptive identification by cytopathic effect only. Specimens may be collected by swab, washings, and fluids, and blood draw. Virus isolation, tissue culture, additional studies, or definitive identification, e.g., hemabsorption, neutralization, immunofluorescence stain, each isolate. This code reports additional tissue culture studies required for specific virus identification and is reported for each isolate. Virus isolation, centrifuge enhanced, shell vial, technique, includes identification with immunofluorescence stain, each virus. This test may also be ordered as a shell vial, SV, culture, a rapid shell assay, or an immediate early antigen test. Specimen collection is by separately reportable appropriate procedure. The technique is particularly useful in identification of respiratory organisms. Immunofluorescence is a technique in which antibody reacts with an antigen on a fixed slide. Virus isolation, including identification by non-immunologic method, other than by cytopathic effect, e.g., virus-specific enzymatic activity. A peptide substrate specific for a viral enzyme proteolytic activity is used for detection of viral infection in primary source biological samples, such as serum and whole cells. Enzyme proteolytic activity is the splitting of protein-peptide bonds with the formation of smaller polypeptides.